So joint pain can be acute or chronic in nature. Depending on the severity of joint pain, we can treat it with multiple modalities. Nowadays we are getting a lot of young arthritic patients, so they start from 40s and there is entire persona for 40s to 60 years of age. For early arthritis, there are a lot of different options that are available, but we would love to say no orthopedician can run without a good physiotherapy. So every surgery or non-surgical domain, physiotherapy plays a very important role for the overall well-being of the patient. Hello guys, my name is Dr.Deep Chakraborty. I am a consultant orthopedic surgeon, chiefly specializing in joint reconstruction and sports medicine. Today we'll be discussing some basic news and the information regarding joint pain. So I'll get a lot of questions regarding what is joint pain and how to deal with it. So we'll deal with one questions accordingly.
What will be the first line of treatment if the patient is suffering from joint pain?
Okay, that's a relevant question. So joint pain can be acute or chronic in nature. Depending on the severity of joint pain, we can treat it with multiple modalities, chiefly being some form of non-steroidal anti-inflammatory drugs, whatever people know it as painkillers, and we also use some other nutraceuticals in these kind of scenarios that also help relieving joint pain. Rest is also one of the very important thing if the pain is acute in nature. For chronic joint pains, there are multiple modalities we can use with pain management plus nerve pain, nerve block. Then again, you can also use some form of physiotherapy to increase the joint health.
How you will relate joint pain with arthritis?
Okay, that's an interesting question. Joint pain does not always arthritis, although in old age the joint pain is usually associated with arthritis. But in young individuals, joint pain does not always necessitate it's arthritis. So we have to look into every individual as a personal individual and devise why the joint is aching.
What are the different stages when patient requires surgery?
Okay, so usually arthritis is usually graded from early to advanced arthritis. In early to modern arthritis of the joint, usually rest, some sort of pain management, exercise, weight loss regime, everything works out. But when the arthritis is advanced, then most of the times we have to do some form of intervention, chiefly being in our knee and hip joints, because arthritis in those joints actually limit our activities. So some form of surgical need or interventional need is usually sought after. So and nowadays we are getting a lot of young arthritic patients, so they start from 40s and there is entire persona from 40s to 60 years of age. For early arthritis, there are a lot of different options that are available, but again we have to individualize which patient requires what. So that can be a very big topic and we have to deal with it independently on case-to-case basis.
When can the patient resume their daily activities after surgery?
So this is a very broad question, particularly if we are speaking about just knee replacement or hip replacement, joint replacement surgery. Usually the implants that we have been using, they are very good, they are very well fixed to the joint. So that being said, patient can immediately walk, perhaps the next day, but due to the surgical insult to the body, patients are initially reluctant, but yes, they are always allowed to move around as soon as possible, as soon as the patient is capable enough to move around. That is very much encouraged in our regimen, and that is what should be done everywhere.
What is the role of physiotherapy after joint replacement?
Oh, that's a really interesting question. Although in Indian setup, physiotherapy is not sought after by a lot of patients for surgery. They love to do it independently. But we would love to say no orthopedician can run without a good physiotherapy. So every surgery or non-surgical domain, physiotherapy plays a very important role for the overall well-being of the patient. And chiefly being said after surgery, physiotherapy is one of the most important things you would need. A professional physiotherapy can make your life so better and it can get you back to work or movement at the earliest of possible with proper guidance. Yes, physiotherapy is very important, very, very important.